get to this. This morning on The Extra, we're talking about heart disease being the leading cause of death among Black adults and the incidence of hypertension, it's a Monday? No, it's a Wednesday, among Black Americans is the highest in the world. I'm talking to my good friends here with us this morning, Nicole Mullins, nurse practitioner at the Christ Hospital, and Allison Poling, is that correct? Executive Director of the Greater Cincinnati Heart Association. All right, so let's jump right into it here, because I just stumbled upon that intro, so I want to make sure we get a clear message across about why this is why it's so important to educate people on this.
You know, Black Americans suffer from heart disease at a disproportionate rate in terms of the number of patients affected, the types of diseases they're affected with. A lot of that has to do with genetics. A lot of it has to do with stress, social determinants of health. You know, we're living in economic instability, not having access to primary care, let alone specialized care in cardiology. Maybe a lack of education, and just a lot of other sort of worldly stressors that put even more emphasis on these risk factors that they already have. Both men and women alike, but particularly with women as well. And coronary artery disease, it's the #1 killer of Black women. So we really have to focus our efforts on education and primary prevention, knowing your numbers and those sorts of things.
Because that's what I was just going to ask. So what can be done? Now we have the knowledge. What can be done now for the preventative care?
So much can be done, and that's, I think, our message is know your numbers when it comes to blood pressure. And that's hypertension, if it's elevated over a long period of time. And so it's 120/80 or less. So when you see that little fraction, 120/80 or less. And if you can get your blood pressure under control, that kind of cuts it off at the head, if you will. You are less likely to get heart disease or stroke just by that #1 modifiable risk factor, which is hypertension.
So that's an important number too. I feel like we should all have T-shirts that say like 120/80.
This is my goal in life. Yes, that everyone would know that number.
And I mean, to educate. Now, how can people, let's say they go to the doctor, it's much higher. Then how do they pivot from there? What's the best kind of, I guess, road they should take?
I think we would both agree it's over time. So it's not like your weight, you take your weight in the morning, it's gonna be pretty similar in the afternoon. It's knowing your blood pressure over time. And yes, if we can get you to the doctor, that's great, but we work a lot on meeting people where they are. We are out in the community with Christ Hospital very frequently. Specifically, think of a company. We work with barbershops and salons for that person that you trust and you're in their chair talking to you about that number you should know. Churches, just all kinds of programs. New moms are at very high risk, so people need to be aware.
Exactly. Again, it's all about education first. You know what I mean? Once you have that, the power is yours. So right now we're taking a look on your screen right now. These are some bullet points. Would you mind walk us through these? Because you were giving numbers before, but about 55% of Black American adults have high blood pressure. I mean, that's pretty incredible to read those stats. And it needs to start going in the other direction.
A lot of it comes from a lack of access to care. So we really have to emphasize how important it is to see a primary care doctor, not for episodic care in the ER, for example. I don't feel well, I go there, they tell me my blood pressure's up, but then I never explore that again. We really need to put our emphasis on seeing a doctor, and it's important to really see someone who understands Black Americans. So we call that culturally competent care. Do you know what that means? That means like really putting emphasis on understanding the culture, understanding the beliefs, how those things might impact your ability to seek out care and what kind of care you will accept, and how accepting you are of embracing the care plan that that person comes up with for you. So it's really important to just have someone who you can relate to and understand, and then really diving into that. And take a friend.
Always
take a friend.
Make it cool.
Make it cool.
Make it and light and good and informative, comprehensive, all those things. Where can people go? Because this is such good information. I wish we had more time. Where can people go, though, to find out more, find out where you guys are going to be? Do you have like a list, anything like that?
I would make it really simple. Make an appointment with your PCP, your primary care. If you don't have one, this is your wake-up call. Get a primary care physician. And then if you're really sitting on the couch worried about this, go to a pharmacy. They have cuffs right there. I always take it. You know, I have my kids take it, try to normalize it.
Yeah.
As Nicole said, we want to normalize the new fad in knowing this number. Like everyone's obsessed with their weight. Really, it's blood pressure. We got to know that number.
Thank you guys so much.
Yes.
Honestly, I appreciate you guys coming out this morning on the Morning Extra, and so much to know, so much to learn, and important, imperative information. Thank you guys again. Appreciate it.